Hey, it's October and it is Breast Cancer Awareness Month. You are seeing pink everywhere, and we wanted to bring you a really informative health video from our friends and partners at the Women's Hospital of Texas. And who better to kick it off with than Dr. Post? She is a breast cancer or breast surgeon at the Women's Hospital of Texas, and we are going to be talking about the importance of breastfeeding. And there's a lot of information we're going to dive into. I hope you'll stay tuned. But first of all, I just want to introduce Dr. Post. Thanks so much for being here.
Hi, yes, thank you for having me. My name is Dr. Stacia Post, and I'm a breast surgeon here at the Women's Hospital of Texas, and I work specifically with Texas Oncology. I deal with breast cancer, benign breast disease, and even women with breastfeeding problems or even advice, like a lactational expert. I enjoy very much living in the Houston area and taking care of women and the occasional man as much as I can.
So, we all know that breastfeeding offers an abundance of perks for both mom and baby. That's well documented. But we're going to speak today specifically on how breastfeeding can affect your breast cancer rates. So, how does it affect your risk if you are breastfeeding?
We have many studies that show that if you're able to breastfeed, it significantly reduces your risk of breast cancer. Now, that's not to say that if you breastfeed, you for sure won't have breast cancer, but we see that if a woman breastfeeds for a year, their risk of breast cancer reduces by 13%, which maybe doesn't sound like a lot, but it is quite significant. 13% is greater than 1 in 10. So, and then if you breastfeed for 2 years or more, it can go up to 28%. So that's a huge, huge difference. I do, however, have women who come in and they tell me, why do I have breast cancer? I breastfed for 5 years with my 5 kids. And those are always the hardest, but it definitely decreases the risk. And we always have to think about a bunch of other risks that are possible. But that's why, besides the benefit of our wonderful infants, it's so beneficial to breastfeed to reduce risk of breast cancer.
Okay, and I should say, we chatted a bit off screen. So you're also a mom of
Yes, Mama
four?
four. Yes.
Whew. Okay. And what are the ages span there?
Oh, well, now you're going to really know. My oldest is 20, and then my
Okay.
youngest is 2. And in between are 8 and 7.
Oh my gosh, bless you. Okay.
Thank
So
you.
our followers know I have twins that are like 15, boy and a girl, and I don't know. We're in it. But you like that sounds like you're in it. So
I am.
bravo for what you're
Thank
doing.
you. And I did
And
breastfeed all of them, although one really did not like it, so it was a struggle. So it is a big, difficult thing that we as women do, but is so beneficial for everybody in the long run.
so what happens during breastfeeding that helps kind of mitigate the risk or lessen, like what's released that is, what are we
Well,
talking?
the breast tissue is completely responsive to hormones. And the biggest things are estrogen and progesterone, which are so very important within pregnancy and breastfeeding. So, when we breastfeed, that is usually a time when we're not going through a menstrual cycle. So, the changes in those hormones are lower. Now, you do need some estrogen in order to breastfeed, obviously, but it's not quite so high as what we deal with our menstrual cycles. So that decreased estrogen level does help to prevent breast cancer in the future because most breast cancers are hormonally driven. Now, there are some that are not, but if a woman is diagnosed with breast cancer, the first thing that I look at, besides the mass itself, is if it's estrogen positive or not. And so that change in the estrogen affects the breasts and therefore can affect breast cancer. So in order to decrease that risk with breastfeeding, it helps to decrease our estrogen levels. Not to mention, it kind of like flushes the system out. If you were to look at a breast and the breast cells, we have lobules that make the milk and then it goes through a duct. So it's kind of like flushing that out and can actually slough off any high risk cells or cancer.
So interesting to think of like the flushing out. So this may be TMI for like my mom or somebody who's watching, but like after I had my babies, I had a breast reduction very early on. Like, I don't know, I was 21 when I had my breast reduction, and they're like, it's a 50-50% chance that you can breastfeed. And at that point, you're 21 and you're not thinking of like what your 30-year-old self is going to want to do. But I went in for my 6 week checkup after I had the babies. They're like, we feel something. And how terrifying, by the way. Like you've just given birth to twins, and they're like, we need you to go get a mammogram because we're not sure. But that just brought me back like 15 years ago to be like, oh, we need to flush the system, maybe. I don't know.
Yes.
It ended up kind of being like that. But do you see that?
Oh, yes, absolutely. And there's other types of cancer that we see that with too. Not that we need to get into it, but even like cervical cancer, having a baby can actually just kind of slough off some of these bad cervical cells. So, yes, absolutely. And we will sometimes see a mass, especially immediately after having a baby, because the tissue that's remaining, if you have a reduction, is still trying to make milk. So, it can get
Mhm.
clogged and cause mastitis and all these things. So, absolutely we feel masses sometimes and then we have to do the hard thing, but a lot of times it can eventually kind of flush out. Yes.
Yes, we eventually got there, but every day was a terrifying thing. So talking about, I mean, obviously there's a breast cancer that like we can help with breastfeeding, but what other cancers can be assisted with breastfeeding? Is there studies around that?
Yeah, we know that it can also help to decrease ovarian cancer. And truthfully, almost any cancer that has some level of estrogen productivity. So there are even some rare lung cancers, but definitely ovarian, definitely breast are significantly reduced by breastfeeding.
Okay, so what I'm hearing there is it's basically all these hormone
Hmm.
type cancers. Okay.
Absolutely.
Um, So when we talk about breastfeeding, obviously when you're in the hospital and they're like, hey, like, let's try this. And you may have been like a super prepped mama, or you may be a mama who's just like, I'm gonna see how it goes. Is there like a window in which it's most important to breastfeed? Is there a length of time that will help from a breast cancer awareness, a breast cancer risk?
Right. I have patients who come in and talk to me about this specific topic frequently because it is difficult. You have an infant maybe who is having trouble latching or your supply is low. And the question is always, how long do I need to keep doing this?
Yeah.
And it's hard to have a straight answer. I will say that the WHO, the World Health Organization, they recommend 6 months of breastfeeding for the infant's benefit. The American Society of Pediatrics, they actually recommend a year if you can do it. In terms of breast cancer, our studies really show that a year is ideal, but we have a lot of smaller studies and we need just more research. But we have a lot of smaller studies that are showing just a couple months can be beneficial. If I have a woman who comes to me and she says, I could only breastfeed for a month, I say that's still helpful. Like, no matter what you can do, you should do it. And also not feel the guilt. Like, I just have so many patients who have so much guilt from not being able to breastfeed for whatever, a year, whatever their goal was. But
Yeah.
in terms of mental health, that's most important. So we should try as long as we can. But the studies show that a year is ideal to get that 13% risk reduction. But any amount is beneficial.
Okay, good to know and I'm glad you brought up that previous point because there are some of us out here who just we weren't able to, milk like the milk never came in or like the
Mhm,
ducts were cut like from a surgery or,
mhm, mhm.
again, kind of that mental health portion.
Oh, yes.
What would be your encouragement to them? Like, are, it doesn't mean that you're going to get breast cancer.
No, no, it doesn't. And something to think about that I've told lots of women is even if you cannot, be solely breastfeeding or pumping your infant, it can still be beneficial even if you supplement with formula. Like, let's say you only make 8 ounces a day, and that's not feeding the baby completely, but that is changing your hormones, that's affecting your cycle. Whatever you can do is
Mm.
beneficial. And we know that this mom guilt and this, mental stress affects breastfeeding. So it's so hard. It's
Yeah.
like this cycle, right? Like, oh, I can't make the milk, so I feel so much guilt and then the milk decreases. So it's so
Yeah.
important to have a good happy quality of life, especially as you have a new baby. It's tough.
Yeah, and I think the support system seems really huge there on how you're being supported by your doctor
Mhm.
or your partner or your family or whatnot. What would be your encouragement to those who are around, like a mom who's just had her first baby and, wants to do this, but
Oh, yes. My biggest advice is just to even help with the small things. That's my biggest thing. Like, even if it's just handing the container to hold the milk or sitting there for a few minutes, because let me tell you, my poor husband had to sit there with me so many times because I would just be tired of pumping or breastfeeding or whatever, because it's isolating sometimes. I think that the world is getting better about women can still be a part of things, but it can be isolating if you're someone who doesn't want to expose yourself. And so then you have to go sit in another room by yourself, I mean, with your baby, but it can be isolating. So I always tell spouses or friends or mothers to just be there, be present, say, hey, can I get you a glass of water? I mean, when my mom would tell me that, I just felt like, oh, I'm seen because she got
yeah.
me a glass of water. So I would just say, be as helpful even with the small things as you can.
I love that. And maybe even make like some of those lactation cookies or whatever,
Yes.
like a little treat that also may have some really good benefits behind that. Being seen, I think, is the most important thing that you said. Like this,
Hmm.
it is hard.
It
It is
is.
hard to breastfeed and but knowing that you're doing it for a bigger cause, but then also like maybe contributing to the longevity of your life. Um, I want to go to this. So I feel like screenings and recommendations change often as to what we should do. And there are, especially when you hit 40 or, you know, there are so many things that I'm supposed to do on my checklist. And I'm like, I don't know. So fill us in on the latest and greatest as for recommendations for screening and then also doing like home care checks. Like what do we need to do?
Absolutely. So the bottom line, and the first thing we have to think about is mammogram at 40. Now, I will say there are tons of very specific situations. If a patient has high risk, if they have family members with breast cancer, if they have family members with ovarian cancer, if they
Mm,
have family members who have had biopsies or just high risk lesions, all of those things make you a high risk for breast cancer no matter what you do. So, those patients we recommend earlier screening. If there's someone whose mother had breast cancer at 40, then they should be getting imaging at 30. So, it's a 10-year difference if you have a family member, especially first degree family member. That means mom, sister with breast cancer, or brother. I mean, hopefully not, but that means 10 years before their diagnosis is when that woman should be getting imaging done. There are other types of imaging we can do also. Mammogram, ultrasound, MRI. There's a new amazing imaging that we've started doing called a contrast enhanced mammogram. And it's basically an MRI, but it's cheaper and it's easier to do. So there are all these different situations where we could use those. If I have a woman with dense breast tissue, I might say, oh, you would benefit from an MRI. Yes. And most of my younger patients do have dense breast tissue to where we may still get an ultrasound or a mammogram, but we should supplement that with an MRI to really be able to see between the dense tissue. So, like, dense tissue is just very, very thick. And if you look at it on the mammogram, you'll just see white, and it's hard to
mm,
see anything inside of there. And the MRI is able to kind of subtract out that just fibrous tissue and just see the breast cells. So, it really depends a lot on your breast, your family history, risk, all that good stuff. So, I would say every woman should be getting an MRI at the latest 40. I mean, I'm sorry, mammogram at the latest 40, and then sometimes earlier, depending on your family history, the density of your breasts, all that kind of stuff.
Okay. I think that's such important information. Thank you for bringing up our dense breast tissue gals, of which I'm a member of the club. And so I think the recommendation for me, at least from my doctor, is that I go every year. That's what's been written. So once I had it at 40, they're like, you don't get the 3-year pass. Is it still a 3-year pass for people maybe who don't have like a family history or origins breast tissue? What does that look like?
That
Or is
is
it every
actually
year?
controversial, and I still recommend every year. According to
Okay.
the American Society of Breast Surgeons, we still recommend every year. Now, I know that that is somewhere that people are leaning, and I think it's the family medicine doctors who have some studies about that. But we haven't found that it has changed our ability to be able to treat early breast cancer. So we are sticking with the 1 year at this point
Okay.
in terms of breast surgeons. But you're right, in that dense breast tissue, you need probably some kind of imaging. It can be an MRI or a mammogram with an ultrasound, diagnostic though, not screening, every year. And then if I have somebody who's high risk, that means greater than 20% lifetime risk of cancer, and we do the calculation for you, then that means every 6 month imaging. MRI, 6 months later, mammogram and ultrasound. And then we alternate.
Okay. So for somebody who is maybe watching this and they're sitting there and like, again, like we're busy moms and we're sort of almost going through perimenopause or we're in perimenopause and, like the kids have their own things. What is your encouragement to them about getting a mammogram screening? Because I feel like it can be such a scary thing. I watched a really funny thing on Instagram yesterday, and it was like this woman had her breast rolled up against like a window in a car that was rolling up. And I was like, yeah, that's kind of how it is. But mom to mom, and also doctor to patient, what would you tell them about the importance and also how y'all keep them comfortable?
Well, in terms of importance, I cannot think of anything else in my practice that's probably more important. I mean, it is just such an amazing and necessary tool to have some kind of imaging. Now, we usually do have to at least start with the mammogram in order to be able to kind of have a baseline and say, what do we need to do from here? And sometimes that means MRI, but it is such an important and necessary tool. However, it is really uncomfortable. You're literally squishing our breasts, which are sensitive organs for women, especially. And so I will say that all of the radiologists that I know, which I think would be the majority of the ones that exist, are I mean, they are typically a breast radiologist. And so that means that they've done a fellowship specifically for breast patients. So they are so good at saying, okay, we do have to squish your breasts a little bit, but we're going to do it slowly and gently, and you let us know if you have pain and things like that. So they're very, very good about trying to make women as comfortable as possible. And then I have some patients who, if they have some anxiety or some other issues that would cause difficulty getting it, we can always use some type of anti-anxiety medication at the time of the procedure. It just depends a little bit on, that specific person.
Well, and I think, and I've had a handful of them. And so the vast majority, this is what they do. They know that it's like weird, that it feels a little uncomfortable. But I will say, as somebody who's done them a handful of times, you guys, it's like over in like 6 minutes or something. I don't know. Like your face may be this way, but you're going to make it through. Is there, and this just came into my head, is there a recommended time that if you can schedule out your mammogram, that maybe, is there a better time in your cycle that would make it like not as sensitive, or I don't know. Is that even a thing? Do you?
Definitely, if you can schedule during a time when you're not ovulating and not actually menstruating, so that was a good 2 weeks. That's best because that means that you're not going to have a lot of inflammation in the breast tissue because the estrogen is just not kind of going crazy.
Mhm.
So I would say those 2 weeks are the best time, especially for pain and comfort, and even for the imaging perspective. Usually they can still see everything, but it just makes it a little bit easier if you can choose those 2 weeks.
Okay, perfect. So for all my girlies who track it on their apps, like my daughter does, she's very good at tracking like exactly, she knows exactly when she's ovulating. If you're doing that, do that and then maybe schedule accordingly. Was there anything that we missed that you would love to share during Breast Cancer Awareness Month?
Well, I really would love to share that our studies don't show that a self breast exam increases the ability to find these breast masses. However, You have no idea how many women I see that they found their breast mass and then we diagnose their cancer, or sometimes a benign mass. I take care of those too. So please do self breast exams, please. Just in the shower while you're soaping up, just see if you feel anything.
I love that. I think it's just knowing your body. And then I think moms are the very best at having the intuition about something being wrong, either with their children or with their own body. And it's up to us to listen to that. And so I'm sure you would urge the same that they listen to their body. If anything feels off, what do they do?
Well, there are lots of options. The first one is to definitely tell your primary care doctor, OB-GYN. They typically tend to be a lot of women's primary care doctors. So those women and men in those situations can know exactly what to do immediately. And the first thing should be imaging. So you should be able to call into your doctor, say, hey, I found this mass, and they should get you into imaging, as soon as possible. You may want to go see them first and then schedule the imaging, but definitely should be the first goal. If you have a certain insurance company that you don't even need to see a doctor beforehand, you can call an imaging facility and say, hey, I am 40 and can I get a mammogram? And then they'll say, sure.
Yeah. Okay. Perfect advice. And something that we always say on here is you should have a primary care doctor. Whatever that looks like for you, whether it's an OB, GYN, or just like your typical GP, somebody that you can go to if you have, things like this that come up, or that can write you orders to go get your mammogram when you turn 40, which would be our, recommendation for sure. Um, I recommend personally that you make a day of it. So I think that you should go have your mammogram and then treat yourself to a little something. Take yourself shopping. Give yourself something to look forward to. That you have a special meal, or you meet a friend, or you take a walk. Celebrate health. That's my recommendation to everyone for Breast Cancer Awareness Month. Dr. Post, thank you so much for being with us today.
You're welcome. Thank you for having me. I enjoyed it.
No, so fun. And our friends and partners at the Women's Hospital of Texas are encouraging you to go ahead. If you are 40 or you have a family history, you need to go and schedule those mammograms. I know that you see a lot of pink during this month, and it can kind of be easy to block it out, but like there are very real women, and very real moms and grandmothers behind the screen who are fighting a very real battle. And we want you to be here with us. So take that step today. And we can't wait to see you next time with another informative health video from our friends and partners at the Women's Hospital of Texas. Until then, Dr. Post, enjoy your day.
Thank you.